You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, he says that your teeth and gums are never too far gone or too bad to be able to have the smile you've always wanted. We're talking about full mouth reconstruction or rehabilitation, as they call it. With us, we have the go-to dentist when you have some severe dental problems, Dr. Dave Rice. Dr. Rice, welcome to the program. Welcome back, I should say.
Yeah, thank you.
Now, I know you brought some photos, so we'll show those. Now, for people that don't know your practice, who's the typical patient that you see? If you had to say there was a typical patient.
Well, the typical patient it's transformed over the years.
Okay.
I mean, initially I started out as a general dentist, so I treated everybody.
Okay.
But lately what's been happening is people come to me that have not been served well with dentistry. And so their teeth are breaking, they have bad breath, their gums have infections in them. And so they're looking for like some help of what should I do next? Give me some ideas of what the possibilities are.
Okay, do you seem to kind of attract this complex dental problem?
We do.
Patients?
People seek us out because of that.
Okay.
It seems like, we still get the general dental patients that come in, but more and more patients, they're coming in and say, I've really searched the internet. I've really scoured to see who's the best out there. And then they said, why did you come? And they said, because of what I've read about you.
That's nice.
Yeah, it's nice of them.
And you wanted to be a dentist. We were joking before we started. Mm-hmm. Since you were 12 years old, you wanted to be a dentist.
Yes. How
does that happen? You had somebody in the family motivating you?
My uncle was a dentist.
Okay.
He was associate dean at the University of Illinois, and he had a good life. And he liked what he did. He helped people out, and people appreciated his talents. So I said, that seems to be a good profession. You help people out, you get paid. It was good for him.
So you also do dental implants. Who's the typical dental implant patient?
Well, I think from a standpoint of dental implants, where I see the biggest advantage for people is when you can put 4 implants on somebody who's worn a denture and suffered through a denture. Because people don't realize what a denture does to people's ability to chew and to speak and to smile and to taste. It's a horrible piece, but people deal with because they don't know any better. So for me, if I can put 4 to 6 implants in and put teeth on them, so put teeth in that are fastened to something secure that they never have to take out, it's a great service.
Now, for the patients that have really bad, like this gum disease you talk about, bacterial infection in their mouth, but you cannot save their teeth. They all have to be removed. What do you do for them? Same kind of thing like you would do for the denture wearers?
Same thing. It's such a great service to be able to put implants in and fasten teeth that they don't have to worry about like they did with the problem they had with their teeth and their gum disease.
We should mention that at your office, you pretty much do everything right there, right?
Correct.
And you do your own implants. You do the surgical part. You also put the teeth on top. You treat people with gum disease, like the bleeding gums, the bad breath, the loose teeth. And I was reading your bio before we came on. You've literally traveled all over the U.S., outside of the U.S., to learn all of these specialties. Do people like that they don't have to go all over the place? Just one center that does it all?
It's nice because it's nice to be able to go to one place and not have to fill out forms and do everything and know that you have staff that you've built relationships with, that you're going to the one place instead of having to pick up and redo everything with a prosthetist and a surgeon and a different place to clean your teeth. So everything is in one place, which is really like a home then. It's like going home for a lot of patients.
Is it less expensive to go to a guy like you that's doing it all right there?
It is. It's nice for me because I can help bring costs down. Because the typical sedation, you have to bring an anesthesiologist in or pay. So our sedation fees are less for sure.
Okay, good.
And then we can do things that like a specialist can't do. So we do everything. Because we do everything, you're right, it saves visits, it saves costs. There's a tremendous savings to the patient being able to get everything done under one roof. Not only the convenience, but also the cost.
Today's topic, we're talking about extreme smile makeovers. Give us a working definition of what that means, because I know you call it full mouth reconstruction, full mouth rehabilitation. What is it?
It's when people come in and they have bad gums, like infections in their gums, or they have teeth that are broken down. So those are typically the two biggest reasons I see people coming in and needing comprehensive care. So something that will help hold their teeth together and make them last longer. So we want it, once we do it, our goal always is to have it so that it's for the rest of their life.
Now, you're a dentist, so you probably think that the smile and the gums are probably like the most important thing. How important are they?
Well, that's a great question, Randy. Will you work with me on this one?
Okay.
Give me a big smile.
All right.
Now try to make yourself feel bad. Keep smiling.
Okay.
Try to make yourself feel bad.
All right.
You can hardly do it. Your face really creates your feelings. I mean, the face is really what really drives you. And so the smile is the part of the face that I'm in charge of. So when people really have that inner smile where they can kind of smile and it's authentic, you can feel it. You can just feel it. And if you don't have that, it's devastating to people. And people that are they feel like they're judged with their teeth, they don't feel good when they smile. And it just permeates everything about them. People judge them because of that, not because of their teeth almost, just because they see that people are beating themselves up. So sometimes people are judged, and it's not their fault. It's incredible how many times people come in, and it's because they have a genetic problem. They have a problem that they're more prone to gum disease because they have a DNA situation where if they have a little bit of buildup, their body goes crazy.
Buildup of what?
Of plaque and bacteria, and so bacteria underneath the gums. For example, my wife, she gets a bee sting on her hand and it swells up like crazy. Or she gets a mosquito bite, same thing. I can be out there, mosquitoes all over me, I don't swell up. She's got a problem with her DNA.
Okay.
The problem with her DNA is she has an overreaction. People with gum disease have that same thing. They have an overreaction
So the bleeding gums, the loose teeth.
A lot of times
it's an infection in the mouth.
It's an infection in the mouth, but sometimes if that same thing were to happen to a patient that didn't have that same DNA, they would never get infection.
Now, you're a dentist.
Uh-huh.
You probably think the smile's like the most important thing. How important is it?
I do. Any magazine you pick up, Men's Health, any magazine will tell you when they survey what makes people attractive. They'll tell you the smile's always in the top 3. If it's not number 1, it's in the top 3. And a lot of times it's number 1. People feel judged by their smile.
Do they tell you that?
They do. The last patient we worked on that we put implants and cemented the teeth in, that's why she had her own teeth, when she was devastated. She did homeless work. She works with people in the homeless shelter.
Okay.
And she knew what those people felt like, because she felt like people judged her like she was homeless because she didn't have her teeth. She said that she went for a car and the salesperson wouldn't wait on her, and she thought it was because of her teeth.
The movies, we talked about this.
Yeah.
Like in the movies, the poor person always has bad teeth.
They do.
Or the street person.
Yeah.
Or they're trying to make somebody look dumb. They remove their front tooth.
They do.
They sell those fake clip-on teeth.
Hollywood knows. Hollywood knows how to make people look, unattractive or like a villain. They know how to dress up the teeth to make you look as the hero or the
Villain.
Yeah. So they know, Hollywood knows either to make them look like a villain or like a hero. Let me give you another example of how important the smile is. 2 twin sisters. They go in for an interview. They both have they're identical twins. One feels good about her teeth. She feels good about her smile. She's smiling all over the place. The other sister, she's not happy about her teeth. She's self-conscious about her smile because she has a gap in it. Both sisters have a gap. But the one who has all the radiance of a nice smile, really feels self-confident, she gets the job. The other one kind of beats herself up, not so self-confident. She doesn't get the job.
So you don't necessarily hire the prettier smile, but if one is smiling, one isn't, you're going to hire the one that looks confident.
Correct.
Okay,
so
that's fair.
Yeah. So obviously, to me, when you smile, it's important, and to feel good about your smile is even better.
Do you see people like they come in with really bad teeth and gums? You fix them up. Do you see changes in their personality?
Oh, for sure. Sure. They don't look like the same person. When they come in, they have makeup on, their hair is done. You can just see the transformation starting to take place. They're going out to eat. They didn't want to go out to eat before. When they laugh, they don't have to put their hand over their face. It's great to see them bring their confident smile back. So I had one lady who was sick and tired of being sick and tired. She had horrible teeth, and every time she came in, she had infections and problems going on. And finally, she said one day, I need to fix this. So we fixed it. And it transformed her life. She was able to eat things she couldn't ever eat before. She was happy with what she had done. She said she made the best decision of her life. I have other patients who said that we've done the transformation and they couldn't believe what had happened. And she came out of after we got done with the treatment, she turned around and she goes, you know, this is better than being married. And I'm not married.
Okay.
I've never been married before, but I can think this is going to be better than that.
When you do these extreme smile makeovers and they look at the mirror for the first time, what's that like?
It's very emotional. People come in and they usually start crying. A lot of times they start crying. If not, they turn around and they give me this look like, I can't believe that you did that. I can't believe that happened. So it's really rewarding because you're helping people heal themselves. You're making people feel better about themselves. So I have this one patient that had a dark tooth, and she lived with a dark tooth. And we told her it didn't have to be like that, but she was concerned that we'd mess it up or that something wouldn't work out right. And she trusted me finally to do it. And now she's smiling all the time, not aware of the dark tooth. So those are sort of stories that just warm my heart because I know that I can heal people. I can make people better.
Good. Good for you. Now, you brought some photos. What are we looking at? And these are like extreme smile makeovers. We looked at them in the green room.
So here's a patient that came in and she didn't like her smile. And
Okay.
I looked at it and I thought, oh, wow, we can do so much for this patient.
Like what's going on there? Because that looks pretty bad.
There's decay, and so she's got some teeth that are rotten from bacteria that have eaten the teeth away. She's got some gum problems around the teeth. Just look at that after. I mean, she's smiling. She wasn't smiling.
That is nice.
She wasn't smiling before. She's in sales, and so it's changed her life. So not only do the teeth look better, but she also can eat and chew, and she's more comfortable with how her teeth come together. So before, things were hitting. Every time she would eat, food would go into her gum line. It would pinch her. Things weren't comfortable. And the teeth were breaking down. And the teeth were sore once in a while. The teeth actually had infections that would actually cause swelling and
Okay.
pain and things like that. So to be able to take care of that for her, now she's able to live life without those concerns that she had with the teeth that were broken down.
Now the confidence goes way up, you say.
It does. When somebody is able to chew and speak and know that the teeth aren't coming out and to feel like they're in there and they're theirs, it's like they have a whole new lease on life.
When you're on a consult, when we look at the before photo, when you're on a consult, does your mind see the future, meaning this is going to be a good one?
For sure. I mean, you can see so much by just looking at photos, looking at how the lip moves, looking at to see what the x-rays show me, how much bone and tissue is left. It's great because in an instant I can tell you what's going to happen to give you the teeth you want. This one is Jim, and he's a patient that's been in my practice for a long time, and he had partials, and he always had problems with them. He couldn't eat things right. They would be sore with him. We worked with him on the partials, and he had gum disease, so his teeth were always loose. So he had to be careful what he would chew because the partials were holding the teeth in, but also the teeth weren't really strong because they weren't in the bone so much. So for him, what we did was a combination procedure. So it changed his life. So don't you think he looks more sophisticated?
Yes.
Doesn't you think he looks more educated?
In the after, yes.
Yeah, and don't you think that he looks smarter? Teeth do so much. When you take a look at a smile, you can see a smile like blocks away. You can tell if somebody's smiling. It lights up the room. So if you come into a room and you have a smile on, you're in charge. But if you come into the room and you're hiding your smile, you're judged as soon as you enter the room.
Now with this guy, because he looks younger too, And you know, respectfully, I say, whenever I hear you as a dentist telling me, Randy, it changes their whole appearance, I always think you're exaggerating.
Yeah.
But the last two that you've showed me, it is, I mean, nobody can deny it. It really makes them look different.
Yeah.
So they probably feel like $1 million.
Yeah. When he comes in, not only does it make him look smarter and more intelligent, more sophisticated, but it also makes him look younger. And so it's almost like getting a facelift. And that's what we try to do. We try to do like makeovers almost with their teeth, because we can do that. I mean, teeth that are shaped in certain ways, that aren't squared off and aren't flat and have some youthful appearance, people notice that. They don't know why it looks young a lot of the times, but there's certain things that we can do in dentistry to actually create a more youthful smile.
On these full mouth extreme makeovers with people with bad teeth and gums, what type of sedation are you using? They're numbed up.
Correct. So we use a combination of pills and we use IV sedation. So IV sedation we use to help to calm them. And so with that, we monitor it, so it's really safe. I mean, the biggest concern that people always have is it going to be safe? And safety is our biggest concern also.
Okay.
So we make sure we monitor the vital signs to make sure that we have just the basics like temperature, respiratory rate, blood pressure, pulse oximetry. So, but we go beyond that. We do capnography so we can make sure that they're breathing. And the alarms are set off so that they're set tight. So if anything goes even a little bit haywire, there's an alarm that goes off and makes me stop and look to see, okay, what's
And you can pull them out of it?
We can pull it out of it. So that's the beautiful thing about having an IV in, is that versus a pill, if you have an IV, there's a way to get right into the system, into your body, so you can put it in and you can reverse things, and they're immediately reversed.
Now, when they do this, is it true with IV sedation you have like very little memory of what happened?
Oh, that's incredible. I can't tell you how many times people come in and they say they don't even remember that they were there, that they come in and we do everything that we need to do, and they go home and you call them and you're like, what did you do again? I don't even remember even going into the office, because the pill that they take beforehand even gets them numb before, so when they can walk in and they can walk and talk and act normal, but the drug itself, Halcyon, actually makes it so that they don't remember.
So it's so fear, because you do get some dental phobics, right? These people with really bad teeth, they don't like going to the dentist.
Right. You asked me before about who my typical patient is, and because we do IV sedation, and not many people do that, especially as general dentists. More your specialists would do that, more like oral surgeons, but general dentists, not many at all, do sedation dentistry. So we do a lot of fearful patients. We do. So, and it helps them, because they don't, once they find somebody like us and they develop trust and they know that they can get things done and wind up in a better place, and they get through the procedure and they're not in pain and their teeth are fixed and they look good, they're so appreciative, they wouldn't go anyplace else. So we had an 80-year-old that suffered for years and was wondering whether it would be worth it or not. And then at 80 years old, had it done. It's never too late to get it done. And she was so glad that she did it. She wouldn't have had to suffer for the 20 years before then. So it's great to have that experience where you have people looking at you and saying, oh, doc, why didn't you tell me? Why didn't you talk to me? And I thought that I had, but we weren't talking the same language, must have. So here's another patient that we did a combination procedure on, and we did it on the top, and she had an accident like 40 years ago, and the teeth were never right, and she remembers that accident like it was yesterday, and she never wanted anybody to touch those teeth. So look at the after. Wouldn't you say that she looks younger?
Yes, she does. Yes.
Don't you think she looks prettier?
Yes.
Yeah, and that happens to everybody. Everybody goes through this. They get that transformation, and they're able to experience that inner smile that comes out and it radiates. It just changes. It changes everything about them. It changes their personality. It's so nice to see that, and so to see her go from not being able to function to not being able to. So for her to not be able to chew, to not be able to be confident in biting into things, and to know that her teeth are secure. Now she can go about life without having to think about her teeth. So you don't want to have to think about your teeth. If you have to think about your teeth, that's not good. Let me show you this next patient.
All right.
So she came in and
wow.
This is not unusual. You say,
it
wow. It
looks unusual.
No, it's not. You'd be surprised how many people won't smile, hide their smile. They'll suffer. They'll suffer until they're ready. And she was ready.
Okay.
So she was finally ready to get things done, and she was glad she did, because now she can talk, she can smile, she can eat things she's never been able to eat before. I mean, the ability to be able to chew foods and simple things like broccoli or chicken or beef or things that you take for granted.
Like nuts or, I guess, fibrous foods, salads.
Yeah, things that...
When you have bad teeth, it's hard to eat salads, you said?
It is. Carrots are like the worst.
Okay.
Carrots are the number one things that people avoid when they have bad teeth because they're so hard to chew. But nuts are in that same kind of category. So, again, your whole experience, once you get teeth, now you can chew things you haven't been able to experience for a long time.
So people like this, when they come in, you say they're like very low goals. Like they don't even know anything could be done.
Yeah.
Is that right?
They think that the only option they have sometimes are dentures. So that's why they hold on to their teeth so long, because they don't realize that technology has changed so much that we can do things we've never been able to do before.
You said you've had patients where they thought they were going to get a lower setup, complete removal of teeth, right, and you're able to save all those teeth.
Right. I mean, the other day a patient came in, and actually we were going to do combination procedure on the top and the bottom. Once I got to the top and looked at how things were going, I'm like, her teeth are so strong. The top was gone. There's no way to save it. So we had to do the combination on top. But the bottom is like, from my experience on top, I'm like, let's not do that. Let me save her some money. Let me save her the time and aggravation of having to go through some of it. And let me do something different on the bottom that's actually going to be better for her long term and actually a little bit less expensive. So she's so happy that she did what she did, because now it's changed her life. It's transformed her again. It's made her so she can smile, that she can choose things. Again, it's one of those experiences where you don't know what you don't know, but once you finally realize what you've been slowly over time avoiding, foods you've been avoiding, situations you've been hiding from, it all changes once you get your teeth back. It's amazing how people get transformed, and they're not aware of how they've adapted over time and how their teeth have made them shrink into certain things in life, and now they're able to live their life in full again.
I mean, I think you've said that when it's all done, these extreme smile makeovers, they come in, sometimes you don't even recognize them because they're acting so differently.
Right. They act differently. They're jovial, they're joking around, they're smiling, they're like a different person.
Do you ever get the wrong read on people? Like maybe a guy comes in, you think he's a tough guy, but then once you fix his smile, he's like a different guy?
Yeah. A lot of times people come in defensive. It's like because they feel like we're going to take advantage of them, and they're guarded. And so once they start to realize that we're healers, not hitmen,
okay,
then it changes. They understand that our goal and their goal are the same, and then we work together. But sometimes people they because of their teeth. Sometimes it's just because of their teeth. They're embarrassed of their teeth, and they don't want me to see it. So you can see almost in the interview.
Now you say some of these people are brushing and they're flossing and they're gargling all day, and they still have bad teeth.
It's the truth, because they have a bacterial infection, and their body isn't able to fight it off. And it might not be their fault.
So you can't brush and floss it out? You
cannot. You need a dentist sometimes to help with that.
Okay.
Yeah, the dentist, sometimes those infections, the only way to get them under control is to go to a dentist.
Now with these bacterial infection, you say you target the infection. What does that mean?
When we target the infection, we actually take a swab and we send it out. We know what bad bugs there are, so we can target those and get rid of those and not kill the good bugs. Yeah.
I mean, this is like your expertise. In fact, when I first met you, you brought in a toothbrush, you showed me how to brush, you gave me this little solution for at-home care,
right,
to keep this bacterial infection
away. There's so many tricks that we have nowadays that we've never had before. And you just have to know what the current research is showing on it, because every year things change in dentistry. So you have to stay up on the topics of how to fight those infections, because what we thought about years ago isn't true today.
Now you actually test. You said I'm a nerdy type of a dentist. I test products, and you're an advisor.
Correct.
For other dentists.
I am, and so it's great because I like to go out there and when somebody tells me something works, I try it myself, and we vet the product and we say yes, it's good, or no, it's not. So, and we get products all the time with people, companies asking me, what do you think of this? So we help them to try to develop products.
We are out of time, but really today's topic of this extreme smile makeover, and you said, look, that you want people to know that you're never too far gone. No matter how bad your gums are, no matter how bad your teeth are, you can still have this like award-winning smile. You really believe that?
I do. People come to me and they think, oh, I waited too long, I've done this, and there are some things I could have done before, but it's never too far gone. There's always something we can do. No matter how bad the situation is, we can always do something. You can go good, better, and best. There's no question, so you're looking at what can be done.
And you say you give a lot of options in your practice.
We do, because people come into us and they're scared. And so some people, all we do is simply just get them out of pain, get them comfortable so they can go back and not have infections. Other people, they want to get everything fixed. And if those people want to get everything fixed, it's like, what would I do to my own family? What would I do if it was me? If money wasn't an object, what is the best thing that they could have done? And we have options. So that's one extreme, and there's another extreme, and there's a million ways in between that they could get treatment.
So everybody could be helped, basically.
Everybody could be helped. If you go to the dentist, I really believe you're better off than if you don't. So when you have problems and you stay away from the dentist, it just seems to get worse. You spend more money because you go away, and you stay away.
People put it off and put it off.
Right, and it gets more and more expensive. If you would have fixed things when they were small things, small problems, but as they get larger and larger and larger, it gets more and more expensive. So,
if somebody wants to make an appointment, do they go to the website, or do they go directly, or just call your office?
It's better to call the office. You can go to the website and kind of get some more information on us, but it's always best to call, I think.
Okay.
Because you get a human contact and they get an idea of who you are and what you're looking for to make sure that you're in the right spot.
Okay, good. I want to thank you for coming on the show. Good stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.